Hey guys, so my study this week was on using low-level laser therapy to improve um, ranges of motion and pain in flexor tendon injuries. And the significance of using this low-level light therapy is that it's demonstrated desirable outcomes in accelerating fracture healings in patients, and they've even used it to grow rabbit tendon tissues. So it's cool that they wanted to see how applicable this was to a real life scenario and real tendon injuries. So this was a study from 2018. It was a randomized controlled trial, and patients were recruited based on a hand surgeon referral from 2015 from a university hospital in Iran. So there were 77 patients. And so these injuries covered anywhere from zone 1 to 3 flexor tendon injuries. And so when they were dividing these up, they were divided randomly either to the control group who received this therapy or this light, but there was no power, so it was a placebo, and then the actual low-level light therapy group who actually received the therapy. And there was one more patient within the light therapy group. So to be in this study, if you had multiple injuries to one flexor tendon, they excluded you. If there was a simultaneous bone injury or extensor tendons, if there was skin loss, or if the patient had a known history of like non-compliance, or if they were under 10 years old, or any wounds. So the population. So for the laser group, the mean age was almost 28, and for the control group, it was about the same. It was almost 27. The study consisted mostly of males. And what I did find was interesting was that 67% of these injuries were the flexor tendon zone 2, which is what we learned about was called no man's land, where the recoveries in the past haven't been great, but since then have improved. So the primary repair was performed under general anesthesia, 6 to 24 hours following their admission. And the surgery protocol was a Brenner incision, which this basically means it was a volar cut in a zigzag pattern along the volar flexion creases. And it was used by a 4-strand modified Kessler core suture method, which all that means is that the collagen fibers of these tendons, they run longitudinal. So for a suture to hold and not slide and cut through these tendons, there essentially has to be anchor points made horizontally, again, so they don't slide, because if they were made longitudinal, they would just slide through the divisions of the tendons horizontally through the tendon with the nylon material, so that the sutures themselves could be tied around and hold the tendons together. And then they were splinted for 4 weeks. Of course, it was 10 degrees extension in the wrist, 90 degrees MCP joint, and 0 degrees flexion of IP joints. So during the therapy, patients, they were under the direct supervision of a hand therapist, and that each procedure in therapy was directed by a hand therapist. So the low-level light therapy began on the second post-operative day, so 2 days after. This was performed 2 to 3 times a week for 4 weeks, totaling 10 sessions, and actually 2 of the participants in the low light level therapy group only went for 8 sessions. During these light sessions, the splint was not removed, so it stayed on, and these laser probes were placed over the repairing site, directly over it. And then they were reassessed on days 28 to 32 of surgery, so at the end of that 4-week period. The passive range of motion was measured using a standard goniometer, and they were recorded for the first session, and they continued for weekly intervals. They also recorded the pain severity for both groups, and they used a standard questionnaire of life scale, and they rated that on a scale of 1 to 7, 1 dissatisfied, 7 completely satisfied. And then the final assessment was, of course, recorded at the 4 weeks. So therapy went well for both groups. There was no rupture observed in this 4-week period. But at the end of it, it was found that the patients in the control group or the placebo group, they were their passive flexion was greatly inhibited, so they weren't able to achieve full passive. And for the light therapy group, there was a great increase in passive range of motion and a decrease in pain, well, compared to the actual control group. And so all of the patients in the light therapy rated their satisfaction as either 6 or 7. So they were all satisfied compared to the control group, which did not. And of course, the reasoning for the control group not achieving this full passive, a lot had to do with joint stiffness and pain. And a major advantage of this light therapy was it found that it could actually change a patient's compliance and increase it. So all of them completed the treatment program, and as I said earlier, they were all very, very satisfied with it. And these laser effects were found to remain effective for at least these 4-week period. And finally, authors concluded that this low-level light therapy is a proper therapy to go along with your typical hand therapy recovery or protocol in this tendon repair. And it's been found, of course, to promote this tendon healing and alleviate this pain. And it assists with this flexibility of the soft tissue and joints, which again leads to a great improvement in patient cooperation, compliance, and even satisfaction. So it was tested during this first 4 weeks because this first 4 weeks of flexor tendon recovery is vital to hand functionality in the future. And it was proposed that this low-level light therapy could accelerate the healing process. And they did ultimately reach that conclusion with the increase in passive ranges compared to the control. And as stated earlier, it was a major strength that this light therapy was effective in increasing patient compliance, whether it was through increased compliance with wearing a splint or returning for their sessions. So what this means, this can be applied to athletes. It's a faster return to sport, faster recovery, decreased pain in patients with similar injuries. And we can even apply this to other diagnoses such as arthritis, where there's a lot of inflammation, which can promote healing, decrease pain. And finally, this is my reference.